The following program presents principles designed to promote good health and is not intended to take the place of personalized professional care. The opinions and ideas expressed are those of the speaker. Viewers are encouraged to draw their own conclusions about the information presented.
Hello and welcome to Health for a Lifetime. I'm your host, Don McIntosh. We're glad you're with us today. And we're also glad, Dr. Nedley, that you're with us and that you could take time out of your busy schedule to help us with a real dilemma.
Thank you.
That real dilemma is depression.
Yes.
From what you've told me, this affects how many people in America?
Oh, it affects at least 14 million people. About 10% of the population will get depression, major depression at some point in their lifetime.
What about worldwide?
Worldwide, it's even bigger than that. It's about 200 million people affected worldwide.
So no matter if you're here in America watching or around the world, this is a big issue. And today we're going to talk about some hopeful ways to combat depression, that being those that are related to lifestyle. These are things that we can actually do something about. We can do something about depression, can't we?
Oh, yes. It's largely a disease of nutrition and lifestyle. And if we can get on the right program, we can not only prevent it, but often treat it.
Mm-hmm. Now, before we kind of get into some of these lifestyle factors, I might just mention to our viewers that you can actually get Dr. Nedley's book. He has written a new book on this. It will be out either in the very near future. Please consider calling 3ABN and getting information about that and how to get in touch with Dr. Nedley, because some of the things we covered today, there's all kinds of footnotes in your book. I love that about a book.
Yes, we document everything from the scientific standpoint.
You know, your last book, Proof Positive, where you had over 2,000 different studies where you could just have at your fingertips and you could find those references. It's really helpful when you talk to people or when you talk to your physician to say, hey, this is why I'm bringing this up. So it's a great resource. Well, let's talk about these lifestyle factors. You mentioned here that social support is very important in combating or avoiding depression. Why do you say that?
Yes, well, isolationism actually leads to depression in many instances, not only in humans but also in the animal kingdom. When animals are isolated, they will tend to actually suffer symptoms of depression. And the same is even more true of human beings. And so having a social support network, which includes not only good family but close friends, are important in avoiding depression, particularly for those that already have a tendency to depression.
So when someone says who's depressed, I just need time alone to work through it, that's not really a good model.
Not really a good model, no. And in fact, there's something even more important than social support, and that is a sense of belonging. A study at University of Michigan took a look at those factors, social support or a sense of belonging. They found out the sense of belonging was even more important than social support. So there are individuals that can have lots of friends, lots of family, seem like they're well socially connected, but they don't have a sense that their family or friends really belong to them. They have no real sense of belonging, and those people are also a setup for major depression.
So the person who thinks that people are just around them because of their money, because of their looks, because of this, because of that, and really senses like if all that was gone, they would be gone too. They're really set up for depression.
They're set up for it.
So how can you, how can you manufacture a sense of belonging? It can't be manufactured. What gives you a sense of belonging? Did the study say anything about that?
No, it didn't say anything about that. That would be a subject for subsequent studies. But there have been other studies that have alluded to it. And that is if you can get yourself involved in a cause that is helpful to the community, helpful to others, and then and that being a team cause, where it brings other people together. When you're working towards the same goals and mission, that will often bring about the sense of belonging and the sense of closeness that you can't get when you're just going to ball games, or you're just having social things that aren't really connected to an overall purpose and goal.
So some kind of unifying, this is not only what I'm doing, but this is how it relates to why I'm here.
Exactly.
That type of thing.
Right.
Well, that kind of reminds you, I mean, being a pastor as well as a nurse, it reminds me of Jesus and that the whole idea to reach the whole world. And he talked about his disciples as if they belonged to him. I haven't lost one of these, or I don't want to lose any, and they belong to him, and that type of thing. So would going, I don't want to be self-serving as a pastor here, but I have to ask you, as a Christian physician and as a scientist, would going to church give a sense of belonging?
It could give a sense of belonging, but it may not either. A lot of churches are more social clubs than they are really working toward a common purpose and goal. And going there might be able to help in some form or fashion just because of the social connectedness. But really, you have to have an overall goal and purpose in mind in order to get that sense of belonging.
So let's say you were going to church because you felt as though those people that you were studying the Bible with or you'd been helping were going to be there and you needed to help them. Would that be a sense of belonging?
Oh, yes. That would be a strong sense of belonging.
Hey, you're helping me out. I think you should come to my church and we'll just share this. Okay, the next thing I see they have mentioned here is cognitive behavioural therapy. Sounds like something you would have for dinner, but what is it exactly?
Well, actually, it's a new type of counseling that has been shown to be very effective as far as combating depression. And I should mention, Don, that the usual type of counseling that is being practiced in this country and that has been practiced for many years has never been shown to be better than taking a placebo pill.
And a placebo is a fake pill, you mean?
Is a fake pill. A placebo pill is just a sugar pill or a fake pill that has no active ingredients. And if we were to compare it to taking a fake pill, counseling, the traditional forms of counseling do no better than that.
So the only thing they do is make money for somebody?
Essentially, and they take up time, and they might produce some sort of a friendship. But as far as actually helping the depression, it really doesn't seem to help any better than a placebo.
So when you mean regular kind of counseling, do you mean like where you go in and the person says, well, what about your past, and what about this, and what did your parents do, and this and that, and trying to, peel the onion skins off and hide?
Yes, that's the usual form. It's an open-ended, there's no time limitation as far as how long this thing is going to continue. And it goes into your child rearing, it goes into the past events in your life and how they might have shaped the current situation that you are in. And often that puts blames on others, puts blames on your child rearing, but doesn't really help you per se. And of course the therapist will say, well, you need to deal with these suppressed issues. You never dealt with this problem that you had with your father 25 years ago, and so you need to go through some sort of mental task of actually dealing with it, and that's supposed to help the depression.
Doesn't help.
Doesn't help, and unequivocally it does not work.
So this cognitive therapy is different than that. It's cognitive behavioral therapy. It's talking about your thoughts and your behavior.
That's correct. It has been around now for about 20 years, even though the science behind it is just now being confirmed. Over the last 20 years, there have been now many controlled studies that show that it is far superior to taking a placebo pill. This type of counseling works. And it's a type of counseling that's focused on the particular problem. It's focused on the individual and what that individual can do differently.
So it doesn't matter if your parents and your grandparents and somebody else, and little Johnny hit you with this stick when you were 3 years old, or you had a traumatic birth that you didn't know about. All those different things are there, but this kind of thing, is it the type of thing that says, you're here now, this is the issue, what can you do about it?
Exactly. That's the type of counseling.
That sounds like a lot like my mother. Maybe she knew about this.
Maybe she knew about it.
Okay, so how does it work? What else should we know about it? How can we get involved in that? What are the sources for it?
Well, really, you would need to, if you're wanting to get counseling, you would want to know exactly what type of counseling is being done. And if it's the cognitive behavioral system, chances are you've got a good counselor there that's going to be able to work through some of the problems. The interesting thing is this has also been shown to be helpful for chronic depression. Chronic depression is where you have had major depression for at least 2 years. And the study that was done recently showed that the average individual had been depressed for 20 years. And a 20-year period of time is a long time to be depressed. And most of these people have tried medicines, they've tried all sorts of things, and have not been successful. Well, what they did is they put them on one medication by the name of Surzone and put them through good cognitive behavioral counseling. 85% of those patients improved in a very rapid period of time, better than what anyone had ever predicted that chronic depressed patients could get better, at least percentage-wise.
How large a study was that? How many people were in that study?
There was quite a few. Actually, I'd have to take a look here, but I must have it in my footnotes. I don't have it in the actual text here. But it was a large enough study to be published in the New England Journal of Medicine just this year. Amazing.
So actually a lot of people out there today watching and are languishing in depression maybe for 10, 15, 20 years, anybody over 2 years, if they have this combination, they have some high hopes. 85% of those that were in the study at least had that hope.
That's correct.
So how can you find out? You got a counselor and you're there. How can you find out whether or not he's really giving you the full meal deal, so to speak?
Well, if he starts going into past events and how they've shaped your life, that's a red flag.
Okay.
Now, of course, a counselor is going to have to get a history on you and help understand exactly where you are, and they're going to have to understand what some of the issues are surrounding that.
But if they're still back there at age 5 or 6 and they stay there for 2 months, that's a problem.
That is a major problem, and I would drop that counselor.
Okay. So, cognitive behavioral therapy is the way to go. You have another one down here, owning a pet.
Yes, now some people, because of their disability or because of their handicap, etc., may not be able to go to church and get into a connected social group. And for these individuals, we recommend, if they don't have one, to actually own a pet and to actually take care of that pet. They will then feel a sense of belonging again. They will have a sense of caring and love, and they'll recognize that there is someone that is dependent on them. And this has been shown to be helpful in select depressed patients.
So patients that can't get out, can't do this, can't do that. Of course, you could get depressed from having too many pets. I mean, I was just talking to a lady the other day. It was at her house. She had like 30 cats and this and that, and it took her all day and I think she was literally depressed trying to keep up. She was more like a zookeeper.
Yeah, you can overdo it.
So, you know, does it matter what kind of pet you own?
Well, actually, the studies haven't looked at that in a lot of detail, but you'd want to own a pet that can relate to you. Probably a turtle wouldn't be the best. Cat or dog would probably be pretty good.
So if you're going to have an iguana, it needs to be a loving iguana, one that can interact with you. Well, but now we have some other interesting things. You mentioned in your book also hydrotherapy. How does that help?
Hydrotherapy used to be used from the 1950s back, even in the 1800s, a lot in mental institutions, simply because it worked, particularly for the acute anxiety episodes and for individuals who are out of control. They would put them in a sheet wrap.
They would wrap them up in a wet sheet, and then the body temperature would warm that up, and by that time they'd be asleep?
By that time they'd be asleep, and they'd be under control, and they'd wake up a whole lot better person than what they went to sleep as. But there's been a resurrection of hydrotherapy. A study down at Michigan State University showed that taking a warm bath, this would be between 99 and 103 degrees Fahrenheit, for about 20 to 30 minutes before going to bed will enhance sleep. And that actually improves one of the major causes of depression, and that is a lack of sleep or a lack of being on the appropriate circadian rhythm cycle. And so it is a good general rule that about 20 to 30 minutes of a warm bath prior to bedtime, doesn't have to be real sophisticated, could be a hot tub, just could be your own bathtub at home, can do a lot in enhancing sleep and actually improving depression.
You haven't mentioned this, but I know a lot of places they practice this, and hydrotherapy, of course, I hope everyone caught that. But so-called ECT therapy, or electroshock therapy,
yes.
Does that have any effect that's positive on depression?
Well, it can help depression a great deal. What it does is actually induce seizures, and it does that under anesthetic. And by having the seizures and having all of this output of the neurotransmitters has actually been shown to enhance mood in the long run and actually prevent as well as cure rather severe forms of depression. However, it does have significant side effects. It will reduce memory. In fact, even childhood memories that are firmly embedded in you right now can just be gone. And even memories of things that happened a year ago can be gone as a result. And so we really reserve this only for the very severely depressed individual. Fortunately, there's a new type of ECT coming up, actually utilizing powerful magnets that seems to produce some of the same benefits without the risks of depression. And there's no seizure being induced. It's not painful at all. It's actually putting magnets on the head and the scalp over the frontal lobe and other areas for a 20-minute period of time. And this is more preliminary research, but it's showing that it might be just as effective as ECT without the side effects.
Do they know why that works?
Well, there are theories as far as lining up the protons and helping out there, but it's still under investigation.
So magnetic therapy, or magnet therapy.
Magnet therapy, yeah, as a substitute for ECT.
Interesting. You have down here stress control measures.
This is very important. About half of depressed patients are that way simply because they have not coped adequately with their stress. And we always put our depressed patients, if stress is a major factor in there, we always deal with their coping mechanisms of stress and help counsel them. Very similar to cognitive behavioral therapy and how to deal with the stress.
So you identify what the stressors are and why they're there, and then help them just get a handle on that.
Yes. As well as dealing with the spiritual aspects of stress. As far as appropriate planning is concerned, many people are stressed out just because they don't plan appropriately. They have too much on their plate. They really aren't looking at things as far as a day's activities or a week's activities.
They overdo it.
And so appropriate planning is very important. Mm-hmm. And then also not being anxious about things that you don't have any control over is another important stress control measure. And in addition to that, the appropriate meditation. And unfortunately, the world is using a type of meditation that helps with stress control measures, but actually suppresses the frontal lobe, our decision-making lobe of the brain. And that's the Eastern type of meditation, where it's a self-hypnosis. The type of balanced meditation is active prayer to God. This is where you can have the same benefit as far as stress control is concerned as the Eastern meditation does, but it's going to be a balanced form of meditation that does not suppress the frontal lobe.
And like you said, if I recall, the frontal lobe is where this depression really originates from. That's what they're talking
exactly.
about. So if you suppress it, you're not really... wasn't it you that told me that in the brain there are 100 billion neurons and they have to all be connected, and the frontal lobe is kind of the orchestra director?
That's right.
And so
it's
if you
unconnect
him, you might have some benefits, but that you really don't fix the conductor.
No, it's kind of like drinking alcohol. Alcohol suppresses the frontal lobe, but it makes some people feel better while they're under the influence. But unfortunately, alcohol is going to end up causing depression. It's one of the risk factors for depression in and of itself. And the same, I think, is true of the Eastern meditation techniques. They're more short-term benefits. But if we were to take a look at the long-term benefits, if it suppresses the frontal lobe, we're going to run into problems.
Okay, so we're not. If you really want to treat it, you need to be involved with the higher power there, the God himself, with prayer and focusing on that. You mentioned also a few things about herbal therapies, ginkgo and SAMe. Tell us about those. How do those help?
Yeah, St. John's wort has been shown in controlled studies to be helpful for mild depression, and I have used it in my practice in certain individuals with success. It can have some side effects as well. We need to consider that these herbs act very similarly to certain medications. And so we have to be alert to the side effects. Ginkgo biloba is another one that can help. It can also have some side effects in thinning the blood. And then third, the most popular is SAMe. It's a very expensive form of treating depression. It stands, the SAM is S, the A is adenosine, and the M is methionine. Those are chemistry terms. But the SAMe has been shown to be very helpful in those that have significant major depression, as long as they're not bipolar or have manic depression. It can actually cause mania in susceptible individuals.
And you say it's expensive. Why? Because you have to form it in a laboratory or something, or what?
Well, it just hasn't been mass-produced enough, and so you can buy it in your vitamin store or in your herbal store, or even your local pharmacy. But to get enough, the ones that, it takes 800 milligrams twice a day to really help major, rather severe depression, and to get enough of that, it'd be about $250 a month.
Wow, yeah, that is expensive. But I'm sure that some people will be willing to pay anything to get over their depression.
Yes, that's true. And lower doses can help as well in certain instances. So,
now come back to this frontal lobe aspect, and maybe we could just spend the rest of our time together. We got about 5 minutes. Let's focus in on that. Since it's the major headquarters for this issue of depression, really, what should we do? What can we say about it? What should we do to enhance its function? What should we avoid that decreases its function?
One of the things that I look at in any depressed individual is, are they living up to their conscience? The frontal lobe is the center of spirituality, morality, and the will. This is what is really supposed to be directing us. And if we are undergoing behaviors that are contrary to what we know is right, in order for us to feel okay about that, we actually have to suppress our frontal lobe. And thus our conscience doesn't bother us as much, and we're not pricked as much. And when we do this, we can end up with depression is the end result. Now, that's not saying every depressed patient is going against their conscience, and that's why they got depressed. But that could be a major hit playing a role as far as the depression is concerned.
So you have to look for what their source of authority is, and whether or not they're living up to that. What the people they live with say is right and wrong, whether they're living up to that.
The prophet Elijah is an example of that. He suffered from rather severe depression, but he ran away from Jezebel. The Lord never told him to do that, and finally the Lord had to say, "What doest thou here?" And so when a person is diagnosed with major depression, I ask them, "What doest thou here?" In a sense, they need to reanalyze things. Are they really living up to their conscience? Have they done some things and are continuing to do some things that they know isn't quite right, but don't know how to get out of that? And that's where the spirituality comes in as well, enhancing the spiritual focus and actually providing through divine intervention, which is extremely important in depression, having them take hold of the divine intervention that can help them to change their lifestyle so it lines up with their conscience.
So renewing their mind through the Bible promises and living up to the things they see in Scripture or within their source of authority, and aligning themselves with that.
It's a very important aspect in treating depression.
So I imagine things then that we would want to avoid that don't enhance frontal lobe optimal functioning would be like alcohol and caffeine.
Yes.
And anything
caffeine is a frontal lobe suppressant, and caffeine has been shown to actually increase the risk of depression, particularly when it's used in large amounts.
What about watching comedy and watching funny people on TV? It seems like they'd all be laughing and they'd feel much better.
Well, for the short term only. Entertainment television actually suppresses the frontal lobe of the brain. It actually is a form of hypnosis if we were to take a look at it real closely. And as a result, it is not a good therapy as far as depression is concerned. In fact, it can actually lead to depression. And so if you are going to watch television, you want to watch educational television. And the way you can tell the difference is pretty much instantaneous. If there's a rapid scene of reference change, every 3 seconds, entertainment television changes the scene of reference, that is going to produce a hypnotic effect. And it's going to lead to problems, it can lead to problems with the frontal lobe of the brain. Educational television will stay on a subject for a longer period of time, as this program is doing, fortunately. Yeah. And so there is no depression of the frontal lobe that takes place. And you can learn from educational TV while utilizing the frontal lobe of the brain.
We've been talking to Dr. Neil Nedley. We've been talking about depression. Let me ask you one question before we close out this program, and thank you so much for sharing with us about depression today. Can an individual that has trust and faith in God, is doing everything correctly, so to speak, can that person, even though there are life stressors like losing a spouse or this or that, can they expect to live their life without major depression?
Even they can have major depression. But the good news is they don't have to stay depressed if they get on the good nutrition and lifestyle program.
We've been talking with Dr. Neil Nedley. We've talked about depression. We've talked about what it is. We've talked about how to avoid it, how to prevent it, how to reverse it. If you'd like more information, contact 3ABN, and thanks for joining us today.